All right, y'all. So we're gonna get into it. Welcome to the Hi. How are ya? Okay, have a seat. Have a seat right here. We're starting a conversation. So we'll get to it a little bit. Okay. All right. So everyone, welcome. Hopefully more people will filter in as we go. But welcome to the Unbothered Talking Circle. And here we have conversations. Come on in. Want to have a seat. Uh, So the talking circle really is about community. It is about connection, and Unbothered is a platform for Black women to be seen, to be celebrated, to be heard. My name is Erica Chitty. I am the SVP of Brand and Editorial Content for Unbothered, and I got brought in to help evolve the brand from entertainment and culture towards well-being and culture, and this circle is a part of that. And so I am really excited to have this conversation. A couple quick things about the circle. So there's no speakers. This isn't a panel. It's truly a collective conversation. I'm going to be your keeper, making sure the conversation is flowing. If you have a question, I will bring you a mic when it's time for questions. And to my right, this beautiful lady is going to be our anchor, taking us through some really beautiful reflection practices, and I'm excited for us to just drop in together. So before we begin, I'm going to open up the circle with the clearing. We always do it. If you are just here, you're going to do one more to get us going. And the clearing is about leaving whatever was happening outside and letting whatever is happening in here be the focus. Okay, so we're going to rub our hands together, and I'm going to count to three, and on three, I'm going to clap. I'm going to hand it over to our anchor. Okay, 1, 2, 3.
All right, can you guys hear me okay? All right, well, I am Dr. Munirah Bomani, also known as Dr. Muni, and I am so excited to be here in this format because when is the other time that you see a doctor in a swivelly chair? When you're in the office, you're stressed out, you're rushing, you're sweating, you're nervous, and you're wondering if everything that you're concerned about is even going to be heard. With a show of hands, who here themselves or somebody in their family has had a bad experience with the healthcare system? Raise your hand if you've had a bad experience. Almost everyone. So if I say, go to the doctor, what's the first word that comes to your mind? You said no? Okay. What's the first thing that comes to your mind when you think doctor's visit? Exactly. So unfortunately, due to no fault of the patients, we have now a system of extreme mistrust, and it's justified. And I think that that is what I really, really want to start with and to center upon with this talk. We feel our nervous systems activating the fight or flight response in the healthcare system for a reason. It's not in our minds. We're not making up these headlines. These are things that are happening in real time. I've exited the healthcare system in a traditional sense because I always said, I want to grow up. I'll be the first doctor in my community. I'll go to an HBCU. I'm going to make a change from the inside out. And I saw as soon as I started my first rotation, and my mom can tell you, I said, this system is rotten. I cannot be a part of this. And she said, just see it through, just see it through. And I kept trying to pivot and change and bring things up and do research and show that language matters, that Black voices matter, that things are happening in the clinics I can't sleep at night. I became a faculty member at a top university because I was like, I am going to train the doctors that make the difference. And what I found over the last decade or so is that even though I'm a squeaky wheel, I'm such a small piece of this bigger problem. So now I'm trying to find spaces like this where I can actually empower the patients to advocate for themselves, because we don't know if the system is going to change in our favor. The system changes every day, and it's worse and worse and worse. Who here had a doctor that you really liked and then you tried to make another appointment and they're gone? Gone. No notice. Who here has no idea where to even start to find a doctor? At least you guys know where to start. So I'm here to really, from the other side of the lens, to tell you that you're justified in feeling how you feel. People are going to try to dissuade you from having your guard up and from being nervous to go to the doctor. You're right to be nervous. The system is changing, and unfortunately, we do now have a two-tier healthcare system for the haves and the have-nots. But if you're somebody who comes from limited means, does that mean that you don't deserve good care? Absolutely not. Just because your family does not have a doctor in it that can come and say, I need you to order this. Does that mean that you shouldn't be able to fight for what you deserve? No. So what I'm here to do is to give you a few pearls about how to advocate for yourself within the healthcare sphere. And we start with advocacy is about education. If you don't know that the odds are stacked against you, you can't even start playing the game, okay? Unfortunately, everyone who's in this room, whether you be a woman, a person of color, the odds are stacked against us. The stats don't lie. We are getting our conditions picked up last. We are getting worse treatment. We're getting more aggressive treatment. There's lots of data that shows that for Black women, they say, just do a hysterectomy. It's fine. Just take it out. Just chop it off. Because there's this stigma that we don't have the intellect to change, that we don't have the intellect to know how to pivot, how to heal ourselves, how to heal our communities. So what you need to do is educate yourself. Who here can tell me what the most important numbers to know are about your health? Just give me a guess. What numbers should you know about your body? Exact blood pressure, number 1, perfect. 2 more, what's the next important thing? BMI, also a tool of supremacy, but BMI is not a perfect tool because when BMI was created, it wasn't for us. It was for a middle-aged white man, so it doesn't always give the full picture. Weight is definitely very important to know, but more importantly, we need to know your blood sugars. Are you pre-diabetic? Are you at risk for diabetes? Blood pressure and elevated blood sugars or diabetes kill our community members faster than anyone else. No one knows why, because there's no research dollars to figure out why. But our pipeline from blood pressure elevation and blood sugar elevation to dialysis, amputation, it is so much more rapid and advanced than anyone else. So if you know your blood pressure, if you know your blood sugars, and you know your cholesterol levels, you can then begin to advocate for yourself and make changes so that you can avoid going to the doctor. You can avoid those emergencies and you can avoid an unfortunate situation. So I wanted to say one more thing before I open the floor, because I'm here to serve you guys. You guys can ask me anything you've ever wanted to ask a doctor, whether it's something that made you mad, whether it's something that you don't understand, that you're confused about. I'm a family medicine doctor, so that means I'm a jack of all trades, master of some. So I can answer pretty much anything that you'd like to know. So 2 of our young ladies here said, when I say go to the doctor, they say no. Did you know that you can get your blood work done without ever seeing a doctor? This is what I mean by a two-tier healthcare system. Things don't work the way that they used to. This is about money. And unfortunately, healthcare now is a business. If you know that it's a business, then you can know how to pivot to be the best consumer. For example, if something is on sale at one store, do you go out of your way to go to a different one? No, you want to go where you're getting the best price. And the same thing happens with lab work. There's 2 sites that I don't work for. There's 2 sites called LabCorp and Quest Diagnostics. You yourself, the same way you go on your app to order a pizza, can order lab work for yourself. So if you're saying, I don't want to go to the doctor, but how do I learn my numbers? You then can advocate for yourself on your own and get those labs done. If you go to a doctor and they say, you're too young, I don't want to check your cholesterol. You say, okay, cool. I will go on my app, I will order the tests myself, and then I will ask ChatGPT to interpret them. And for many patients, that's enough. So that takes a barrier away from you getting the answers that you need. You can go yourself and get those tests done. The same thing applies for pap smears, for colonoscopies, for mammograms. You don't need me anymore. You can go online to colonoscopyassist.com and find a doctor that will do it for you. So yes, just 1 second, let me close it up. So all of this to be said that the world of healthcare is different. You guys can all feel that the tide is shifting, but you might not have somebody sitting down with you telling you exactly what's going on. So this is me telling you, you're right to feel nervous because it's a changing world. You're right to feel a little bit uneasy because no one is explaining to you what's going on. But also, I want you to know that you are in a position of power. If you do not seek your care from a particular person, they don't get paid. You are in control. You can research whomever you'd want to see and make your appointment with them. If they are not meeting your standards, you can easily switch to someone new. Please don't limit yourself to an abusive relationship with a doctor who does not listen to you and will put your future in jeopardy. You have the power.
I was gonna ask, like, what is the cost around, like, doing all of that yourself? Because I know people depend on, like, insurance, whether they have, like, Medicaid or if it's, like, through your employer. And it sounds amazing, like, that you don't have to go to the doctor, but, like, I know cost is always, like, a factor.
Absolutely, because this is a business, right? This is America. It's money talks, right? So I'll let you guys in on a little secret. From the doctor side, I hate insurance too. I don't want to work with insurance at all. For example, you go to a doctor's visit. I took my son to the doctor, regular pediatrician visit, looked in his ears, did a physical exam. The bill from that visit was $1,500. How much did the doctor actually get? $30. $30. So for myself as a private practice physician who has a direct primary care practice, I would much rather make a deal with you directly than work with insurance at all, because you're paying every month to an insurance company that denies all your claims anyway. And they also are going to deny payout for me, which is going to cause my business to go out of practice. It's the insurance companies who is telling us we have to see somebody every 15 minutes or we won't make enough money. It's insurance who's saying I can't just have 500 patients or 200 patients or 100 patients and spend an hour with all of them. So if you find what's called a DPC or a direct primary care practice, you can actually have a membership like Netflix. Most direct primary care practices are about $20 or $30 a month, and you get unlimited access to your doctor. You can call us, you can text us. And for the lab work, you would be surprised. The same labs that the hospital is billing, for example, basic labs, cholesterol, blood sugar, etc., at most hospitals and clinics is about $500. If you order these tests on your own with no insurance and no doctor, it only costs $80. So hospitals are upcharging everyone. Everybody loses except for the shareholders. So that's why I always tell patients the system does not work like it used to. Your high deductible claim will have you paying more money out of pocket to see that doctor versus if you were to just budget and pay for it yourself. Most doctors also who are having DPCs will have payment plans. So if your doctor's visit is a $99 flat rate, if you don't have a membership, you can then pay that off in 2 or 3 or 4 months. Or if you tell them that you're having financial challenges, there's more flexibility for us to work it out. So that's why I really encourage you to really see that the system is not working for us. The system is not designed for us because is there a billionaire in here? Okay, let's talk. Unless you're a billionaire, honey, the system is not built for you. So we have to get crafty and we have to get creative. The same way that you research everything else. You research your beautician, who's gonna do your nails, who's gonna do your hair, and what the price is. You should be doing the same thing with your healthcare.
Thank you.
Sorry, I know that's a lot of new information for y'all.
Hello there.
Hi.
This is my question. Every year we're encouraged as women to go and get your pap smear done.
Yes.
And so I do that.
Yes.
Why has it in healthcare that, and that's the check for cervical cancer,
Yes.
but so many cases of ovarian cancer get undiagnosed, and I know just from personal experience, that's diagnosed through a vaginal ultrasound. Why can and I know you might not be able to answer it, but it's a frustration of mine, and I wish I was a person who can be an advocate that I advocate for myself.
Yes.
Because I have an appointment coming up, and I said, okay, I have my appointment for this, but I would like to do a vaginal ultrasound the day before, and I got it scheduled. But so many people think when they go to get their pap smear done, they get checked for everything.
Exactly.
And they're not. And it just saddens me. It really does. So, anyway, I guess it's more of a complaint, and
Yes, let it out.
So I just try to share with women, like,
Yes.
you can ask to have a vaginal ultrasound so that you can see if you have any kind of cysts on your ovaries that they can then do a pathology report on to make sure it's not anything, because so many people don't know that.
Yes.
But it's a simple test, so
super easy.
you shouldn't
Super
have
easy.
to advocate for it yourself. That should be part of your annual exam.
You are absolutely correct. And back in the day, doing these tests, checking your ovaries, was part of your annual exam, if you remember way back when. So an interesting thing is happening in healthcare in terms of cost savings and acceptable risk. So when we think about the guidelines, right, we all know these buzz numbers. Oh, mammogram at 40 or 50, colonoscopy at 50, pap smears are now at 26, which is insane. They're not based off of you and your specific case. It's based off of insurance and what they'll pay for. So just because, and we see this, the most common examples with Chadwick Boseman, right? May he rest in peace. He was way younger than the guideline for colon cancer screening, but he still, unfortunately, passed away from colon cancer. These guidelines don't mean anything. If you feel that something is wrong in your body, and this goes back to that advocacy, the guidelines are not meant to protect you. The guidelines are made to prevent unnecessary test orders to save the healthcare system money. That doesn't protect your health for you. It doesn't protect your future. It doesn't protect your family. So if you don't have a relationship with a doctor who can hear you and say, you know what, this is a very easy test to do. It's very easy to add on. It takes 15 minutes. You have to find another doctor. Also, there's a website called radiologyassist.com. I do not work for any of these people, y'all. That you can actually look up whatever test that you want to have done and go do it. It doesn't have to be a closed door from me, wouldn't be me, but from one of my colleagues that stops you from getting the care that you deserve. And I think that the most important thing that I want to really anchor for you guys is that the guidelines don't mean anything. Technically, the guideline is that you shouldn't even be having a pap smear every year. Now they say every 3 to 5 years. But in that 3 to 5 years, there's a certain amount of women who will develop stage 3, stage 4, or stage 5 cervical cancer. But they say, oh, it's just a small percentage of women. That's an acceptable risk. Acceptable to who? You're somebody's mother. You're somebody's sister. You're somebody's daughter. And that's what I mean to say that the system is not designed to heal us. It's not designed to protect us. It's designed, unfortunately, to minimize the financial loss of ordering unnecessary tests. So if you feel that something needs to be ordered, do not stop until it's done. Because I promise you, what that doctor won't do, another will. And what that radiology center won't do, another will. You can get x-rays, ultrasounds, you can get CT scans, all of these things without insurance and without a referral if you go to a freestanding radiology practice. You just have to know, you have to know what to Google. All of this information is available on the internet. We're so blessed to have access to all of this information at our fingertips. You just have to know what you're looking for. Oh, hello. You want to share my mic?
It's okay. You can have your mic. So thank you so much for sharing your knowledge.
Yes.
My name is Taquita Love, and
Hi,
I'm
Taquita.
actually a registered nurse.
Hey, girl.
I've been a nurse for about 20 years with background in pediatric oncology, so I'm
Oh, girl,
familiar
thank
with the
you,
cancer
girl.
world. I lost my grandmother to breast cancer. One thing I wanted to state is just like advocacy for our parents and our grandmothers. Because when my grandmother was diagnosed with breast cancer, she was diagnosed in Indiana, and she was out there by herself. I lost it. I found out she was going to her treatments on the bus. They had did no connection. They didn't hook her up with any case management or anything like that. And so one thing I always like to, because of my experience, I do work as a case manager. I worked at a lot of places as a nurse. To make sure that, once, if there's a hard diagnosis, there should be some resources. And if it's not connected directly, it could be indirectly from programs. So once I did speak to someone about my grandmother, I was like, where's the case manager? Oh, she don't have one. Well, she needs one. Okay, where's the social worker? And I think a lot of times as I don't want to say as Black people, but like we get quiet and we want to keep all of our problems to ourselves. We don't want to bug anybody. And I think it's really good if you know somebody that's a nurse or a doctor, call them, share what's going on, so that we sometimes can creep in and advocate on behalf of our loved ones. Because for me, it hurts me when people go through stuff and we can help. I'm like, Granny, you've been going on a bus to get treatment for a year? You know, no, somebody should come pick you up. They got programs for that. And so that's one thing is when you say advocate for yourself, there's another way. Ask other people that you know, and don't be ashamed to share what you're going through, because someone can help.
Exactly. Oh my gosh, there's so many layers to what you brought
I'm
up.
so sorry.
No, it's
No,
good. It's
that's
good.
I'm so
Sorry.
passionate about this world.
Yes.
So
Yes.
yeah.
So first thing I want to say is you have to follow the money, right? So you're saying there's programs that exist for all these things. They're giving government funding for this. Your tax dollars are paying for a lot of the grant funding that they're getting for cancer support, for substance abuse support, for all of these things. And unfortunately, they don't tell us. So every major hospital system has case management, has social work, and has community resources, but it takes an extra 5 to 10 minutes for the doctor, the nurse practitioner, whoever, to take a step back and connect you. All it takes is a simple referral. And unfortunately, because of the cost and the hassle involved, these dots are not being connected. So when you talk about how we have terrible rates of survival for breast cancer, for all of the chronic conditions, is because we are not being directed to the resources that we are paying for.
Yeah.
And that's what leads to our poor outcomes. You may miss, I hope this isn't her case, but I'm like, she might miss a chemo session because the bus was late. She may miss a session because she overslept and nobody's there to check on her. She should have a home health nurse. She should have a case manager. She should have a social worker. But if she's not there to advocate for herself and you're not there to advocate for her, unfortunately, our elders are being pushed through the cracks, because I've been on the other end where I'm in a busy hospital setting as academics. I'm working 24 hours at a time and I'm stressed, but it only takes 5 seconds to click a few buttons and put in a referral.
Yeah.
But also, you don't know what you don't know. So if you don't have a family member who's saying, you need to call these people and say if, whether I can get connected with this and that, then you're lost. So I think that the last point that you made is very important. This is why we gather in community. This is why we gather in circles, because we have to tell each other what's going on. We do shrink ourselves down when we go into the healthcare system. But it's crazy because if you think about it, you are being stolen from. Your tax dollars are paying for programs that you're not able to access. Now, if somebody pulls up and steals $200 from your check, I bet you'll have something to say. So we need to have the same type of energy when we're interacting with the healthcare system. If you are paying through your job, they are deducting money from every single check for you to have insurance. Why are you not demanding that you get the care that you deserve?
Yeah.
And I know that it is exhausting. I know that it is anxiety provoking, because even for myself as a patient, I have gone through horrible outcomes. My children almost died in childbirth at the hospital I delivered babies at from the people I trained. So it just, girl, you brought up such a really sore spot in terms of advocacy, because if we looked a little different, if we presented a little differently, and there's studies that show if you dress up a certain way before your appointments and you put on a nice blouse versus coming in your bonnet and a t-shirt, you get completely different treatment.
Yeah.
And this is something that almost made me leave healthcare altogether, because I'm like, this is insane. The things that I see happen on a daily basis, I could cry about it for years to come.
Yeah.
But what I want to leave you guys with is, I don't know how we're doing on time.
We're
Okay,
over,
good.
so I
what
wanted
I
to.
want you guys to leave here with is the courage and the knowledge that you can and should ask for better. If you have a feeling that your doctor is BSing you, call them out. If you have a feeling that you're being brushed by the wayside, make them documented in the chart. And you can say, I feel that you are not listening to me because this. Can you just explain to me why this is your chosen path? And usually when you call people out, they'll start to straighten up just a little bit. And unfortunately, this is a little unethical, but I usually tell my patients going through difficult diagnosis, lie. Say, yes, my brother-in-law, he's a physician, and he told me to ask this. If they know that somebody's protecting you, they know that somebody's in your corner, that's called professional courtesy. That means they start straightening up. They say, oh no, if I don't treat this person well, this might come back to me. Everybody else, it's fine. So lie. Say, my sister is a doctor, or my sister is an oncology nurse, and she told me this. If they know that somebody is protecting you, I promise you the treatment that you'll get will be 100% different. And you probably have seen it too.
Yeah. Well, thank you so much. I wish we had more time.
I know.
We'll have to do this again next year.
Yes.
Well, everyone, we're going to close the circle with a clearing. Thank you to the circle. Thank you to our anchor. And I hope that you take all this information. You feel fired up to get the care that you need. So much came out of this. Grateful for you.
Yes.
Okay. All right, everybody. We're going to rub our hands together. Take a deep breath. Just let everything just sit, settle in your body before we head out of the circle. I'm going to count to 3, and on 3, we're going to clap one time. Okay, let's go a little faster. Let's go faster, everybody. Okay, 1, 2, 3.
Thank you.